When you're in pain, the first thing you probably reach for is a painkiller. But which one is right for you? Acetaminophen and ibuprofen are two of the most common options, but they work in very different ways. So, which one should you take? Let's break down the key differences and help you make the right choice next time you are in pain. Hello and welcome back to Med Talk. My name is Dr. Tarun Diamond, and I break down the complicated world of medications and health topics into an easy to understand, practical information that you can use in your everyday life. Remember, this is not a medical advice, but rather intended for educational purposes only. If you are finding this video helpful, don't forget to hit like and subscribe for more content like this. Here are some key facts comparing ibuprofen and acetaminophen, also known as paracetamol in some regions. Let's talk about what they're used for. Ibuprofen is a non-steroidal anti-inflammatory drug, also known as NSAID, that reduces pain, inflammation, and fever. Commonly used for conditions like arthritis, muscle aches, menstrual cramps, and injuries. Acetaminophen is primarily a pain reliever and fever reducer without significant anti-inflammatory effects. It's often used for headaches, mild pain, and fever. Let's talk about how do these medications work. Ibuprofen works by inhibiting cyclooxygenase or COX enzymes, which reduce the production of prostaglandins, components that cause inflammation, pain, and fever. Acetaminophen, its mechanism is not fully understood, but likely involves blocking COX enzymes in the brain, which reduces pain perception and regulates body temperature. Now let's talk about how effective are these medications. Ibuprofen is more effective for pain involving inflammation, like muscle injuries or arthritis. Acetaminophen is better for non-inflammatory pain, such as headaches or post-surgical pain, especially when inflammation isn't a factor. How long does it take for these medications to start working? Ibuprofen takes about 30 minutes to start working, with effects lasting 6 to 8 hours. Acetaminophen, on the other hand, starts working within 15 to 30 minutes, and effects typically last 4 to 6 hours. How safe are these medications and their side effects? Ibuprofen can cause stomach irritation, ulcers, or gastrointestinal bleeding if taken in high doses or over a long period. May increase the risk of heart attack or stroke with prolonged use. Avoid in people with kidney disease, as it can reduce blood flow to the kidneys. Acetaminophen is generally gentler on the stomach with fewer digestive side effects. It can cause liver damage if taken in excessive doses or combined with alcohol. It is safe for use in most people with cardiovascular or kidney disease. How much of these medications can you take? Ibuprofen, standard adult dose, 200 to 400 milligrams every 4 to 6 hours as needed. Maximum 1200 milligrams a day for over the counter, 3200 milligrams a day for prescription. Overdose may lead to stomach pain, nausea, or kidney damage. Acetaminophen, standard adult dose is 325 milligrams to 1000 milligrams every 4 to 6 hours as needed, maximum 3 to 4000 milligrams a day, depending on the brand or guidance. Overdose is a medical emergency and can cause liver damage. Who should or should not use these medications? Ibuprofen is not recommended during late pregnancy due to the risk of complications. Should be used cautiously in people with gastrointestinal or kidney issues. Acetaminophen, generally considered safe for used during pregnancy and breastfeeding when taken as directed. Often the preferred choice for individuals with stomach sensitivity or on blood thinners. Can you combine acetaminophen and ibuprofen? It is generally safe to alternate ibuprofen and acetaminophen for severe pain or fever under a doctor's guidance. Combining them may provide a better pain relief than either drug alone. However, the timing and doses must be carefully managed to avoid exceeding maximum doses for either drug. So whether it's acetaminophen or ibuprofen, knowing when and why to choose one over the other can make all the difference in how you feel. If you need quick pain relief without inflammation, go for acetaminophen. But for swelling, muscle soreness, or injuries, ibuprofen is your best bet. Just remember, both have potential side effects. Always check with your doctor if you're unsure which one suits you. Pain relief doesn't have to be complicated. Just choose the right tool for the job.